What is the role of prevention?
Yes, so obviously the prevention, okay, obviously there is secondary prevention and primordial prevention.
Correct.
Secondary prevention is already you have a heart attack and now you're on treatment, you're being already diagnosed and now you're on treatment.
Yeah.
If you have diabetes, obviously you need to have those diabetes controlled. If your blood pressure, or you have to keep your blood pressure under control. It should be lesser than 140/90. Your sugars, your fasting blood sugar should be lesser than 126. Random blood sugar should be lesser than 200 milligram per dl. So these are the few certain things. Even your cholesterol should be under target limits. Your LDL cholesterol, if it is diagnosed for heart patients, now they have made it more stringent. It should be lesser than 100. And for the high risk patient, it should be even lesser than 70 milligram per dl, the LDL cholesterol. So these are certain things that emphasizes that if we prevent these risk factors, it will prevent from recurrence of heart disease. It will prevent from any future cardiac event. So these are the certain points that prevention is always better.